Okay, there's a ton happening in the world since we last spoke with the pandemic, with civil unrest, and people have had it one way or another. At the same time, we've had a lot of people who have been out and about, different means to the same end, of course, which has been people out gatherings. It may be a boardwalk, it may be a protest, it may be trying to get your hair cut, what have you. As you've told us countless times, viruses don't vote. They don't care about any even social issues that are important. So
Right.
it looks as if we are starting to get in that area of data from Memorial Day weekend, not the protesting period, but at least Memorial Day weekend, that time frame. And it doesn't look like anything has truly been set back yet as far as reopening areas of the country.
Well, when it's all of how we define setbacks. I think that from a healthcare provider point of view, we anticipate that as we regain activities outside, and I could tell you, you can be, as an observer, at least in my area, I see less and less people wearing masks and more people outside. So I think that, as we already said, the virus is not gone. The virus is here. Will we see the same rise of cases that we've seen in the beginning? Likelihood is not. Why? Is because they're still partially social distancing, there's still partially PPE and all the other stuff that we did. It's not completely gone. So there's going to be some kind of a balance. I I think that to just clap our hands and say it's over is premature. I think what's over is the high number of ill patients and the high number of deaths. But as you could see, in a country where there's absolutely very little social distancing and other activities that we do to reduce the transmission, mortality is extremely high, and that's Brazil. So you know it's not over, and as said over and over again. But I think in the U.S. there is a sort of a reduction of infection on one side and increase in activity, and maybe we haven't reached the crossing point yet.
What are we looking at as a determining factor for reaching that crossing point? I would guess that it has to do a lot with getting the data in over the last 10 days or so, where we've seen significantly large gatherings that we haven't seen since COVID has hit as a result of protesting and rioting, as a result of people just gathering, if it's peaceful or not. And that also includes law enforcement. Now you're dealing with media, law enforcement, protesters. You're dealing with tons of different people that are involved in all of this. And I imagine that would probably be the determining factor of when you hit that X.
Um, yeah, I think to some extent, yes. The X is where we're going to start uh, seeing again that the social distancing and everything else has reached a point where it's diminishing, and at the same time, there's going to be some sort of a diminishing number or the plateauing of the number of new cases. We're not there because we're still reported almost daily on the increase in number of cases. Again, keep in mind, it's not at the same rate that we've seen in the beginning of the pandemic, but it's still there and it's still a concern. So I can't tell you where that chiasm is, where the crossing point is, but if things remain the way they are right now, I think we're probably going to be achieving that crossing point within about 30 to maybe 45 days. We'll know whether the rise of new cases is actually very muted as compared to the initial exposure that we had with the virus.
If we see, which is predicted, I would imagine, by you and a bunch of other doctors, medical professionals who have been studying and fighting this, that there will be an increase in transmission because the country reopens. Is it going to be something that you can actually discern between the two, which is we saw an increase in cases because the country reopened, and that's normally going to happen. Germany and Other countries have had examples of it where simply reopening and allowing people to kind of get back into a lesser form of social distancing is going to naturally increase a spike, even if it's not a surge. Or is it going to be attributed to just the large amount of people, even if it dates back to Memorial Day, to where we've seen a stretch probably of a month straight of people just out and about in large gatherings for different reasons, of course?
So, again, we can say that large gatherings, an increasing number of gatherings, will be associated with a increased risk of transmission. However, keep in mind that even in large gatherings today, as compared to 6 months ago, people are still timid, and still there is a majority within that gathering who probably practice some kind of protection, whether it's hand washing, whether it's wearing a mask, whether it's staying a little distant from their fellows, not sneezing on them and not coughing on them. So there's going to be that element that, yes, if you're going to be in big crowd and somebody's infected, there's clearly going to be some level of transmission, but it's not going to be as high as it was in the beginning because, again, our behaviors have changed. So it's not a science in terms of that's proof that having a large gathering will cause infection. But clearly, when you look at it from a risk assessment, large gatherings have a higher risk than you being protected by keeping social distance.
Where are we with testing? That was such a hotbed political issue for so long, and it waned off. And now we're dealing with other issues where you're lucky to even get COVID-19 mentioned on a newscast, no matter where you get your news. I am curious, though, it seems, and this is my question to you, that we're at a point where if everybody who was at a protest, for example, 10,000 people, including law enforcement, media, et cetera, wanted to get tested, that it wouldn't look like, oh my goodness, where we were 2.5 months ago about there being such a large concern of a shortage of tests, and that results in people that can't get tested out and about in our society.
So depending on the type of test and depending, of course, on the location, the availability of testing for COVID-19 infection is clearly much better today than it was a few weeks ago. So there are now ample number of test kits available, and I think that the cost has gone down, and some places don't even charge for that. But the question, of course, is so you get tested and it's negative. You could still be positive a few days later.
Right.
But that particular test, in terms of diagnosing whether you have the disease, is getting much, much better. The other side of the coin is testing the antibodies, and that is a conundrum still. We don't have good tests for that, and we're not sure whether it's the tests themselves or whether it's the virus behavior, meaning in terms of how long the antibodies last, or a combination of both. So right now, that portion of testing to determine if you had immunity, meaning that you were infected and not currently infected, that's still a concern. And for many people in healthcare, that is a concern. We'd like to get this one worked out as soon as possible so that people are coming back to work, at least those who've had, we can determine who've had the infection and possibly have immunity, clearly, again, suggests that their risk of getting reinfected is very low. It doesn't necessarily mean that they won't transmit disease, but at least it could be working without risk.
Is that enough, in your opinion, not even from solely a medical point of view, but as somebody who lives and interacts in our society as well, to remove enough doubt and concern without having a vaccine? Meaning, if an antibody test is legit enough to pass, is that enough for the average citizen to say, okay, I got tested for antibodies, it came back, I know that I had it at one point, I now have a sense of immunity to it, I can go back to work, as opposed to just waiting for a vaccine, which may come 6 to 12 months from now?
Well, let's hope. So again, all I can tell you is that if the test was a reliable test, meaning its predictive value was extremely high, the answer is that yes, you could play, I guess, the waiting for vaccine with this test in terms of people who may have immunity. The problem is that we can't really tell how well these tests perform at this point. And we have a lot of people who get tested who are negative, who had infection, and vice versa. So it's still a problem in terms of the validity of those tests. So until then, we are looking for a vaccine. And again, keep in mind the vaccine needs to also be tested because we don't know how effective it is. When you're looking at the flu, vaccine can be as poor as 30% coverage to maybe as good as 60% coverage. They're not 100%. And the person who gets inoculated with influenza vaccine, you don't know if they're in a 30 or in a 60% group. So this virus, the SARS virus that we're dealing with right now, we don't even have a good baseline to start with in terms of how we could use the antibody testing at this point.
What should we expect if there really isn't any major spike? And I mean more than normal that you would see with basic reopening of society from low numbers in the next 2 or 3 weeks from protests? Meaning, if in fact numbers came back and they were significantly low as far as increase in transmission, and knowing, of course, that somebody's going to give it to somebody else in a group of 10,000 people, that's impossible to avoid at least one, but it comes back lower. Is that not going to reinforce a faster or an expedited reopening of society?
I think people are extremely impatient at this point.
Well, yes, absolutely. But doesn't that help, though, to see those numbers come out that way of a protest, that they would be significantly low, and then say, well, why the hell can't I have a wedding or a gathering of 150 people, something along those lines?
No, I think that's very rational to ask the question. I think that as you know, there are two schools of thought. One that says that we should not be locked down, and another says that we should be locked down. And there are actually country experiments. We talked about Scandinavia previously, where there were no lockdowns, and there are some states where there's a low a lockdown, which affected the economy and the psyche of the population. I think it's a rational question to ask. I think, though, that um, the current feeling is that we have a stepwise approach to resuming activity. And what would be very helpful is to see that the rise of cases as reopening occurs is not significant. It's just going to give people more courage or more incentive to push to the next phase and maybe actually shorten the time to the next phase of reopening. However, regardless of this, no matter what happens, our behavior has changed. We currently are still concerned about distance, about covering, and about washing our hands. And there's some people who are not concerned about it, but I think the majority of the population still has had a change in behavior, which I think is going to help reduce the numbers that we're seeing.
If in fact we do get, let's look at the opposite. How can we look at an increase in numbers? Because you rarely get specifics, right? You just say, wow, or you see, pardon me, wow, an area, a state, a town, a region reopens and an increase in cases. But you rarely see, are they asymptomatic? Are they centralized in one area? Is it a nursing home with 60% of those cases that were positive because one person went to visit their grandma, whatever it may be? Is there a way in which you can see a number go up, an increase in transmission as a result of these large gatherings, but it not be a death knell to where we are as far as progress in opening up this society?
So you hit the nail on the head when you said death knell, because essentially what we're looking at is the number of individuals infected and the number of deaths that are occurring. And as you could see from list reports that are out there, is that the number of infected people may be going up in certain areas, but mortality clearly is still low.
Do you have to get that? Okay. So that's going to be the biggest indicator? Is it going to be that and hospitalizations? Is it going to be discharges? My question to you is, when inevitably we get this data back in the next 2 or 3 weeks, people can come back to this video and look at what you'll say, which is how to truly, and even from a layman's standpoint, how to interpret a spike or an increase in transmission and not recognize it as the end of the world.
Well, no matter what, being sick is not no fun, especially
Sure.
with disease. But we are seeing again people testing positive. The symptomatology and their clinical findings may not be as severe they were in the past, but again, the big measure is going to be mortality. And what we're seeing now, areas that had a big surge, such as the New York area, some of the hospitals don't even have any COVID-19 patients in them today. So again, the frequency of the illness is dropping significantly on one side, but mortality, which is the ultimate measure in terms of what happens during a surge, that's going down too, which is reassuring.
So, a question that has come up a couple of times on social media with me, and I figure it's best to have you describe it as opposed to me paraphrase what you tell me. Wearing a mask. Let's redo this because the virus has changed, new information, data, etc. At one point, it was the M95 or bust. Can you be at a large gathering like a protest? Can you be in an area outside or inside with hundreds and maybe thousands of people around you and wear something other than a medical PPE, M95 or something similar, like a bandana or a piece of cloth, something along those lines, and still be safe from not only getting it, but transmitting it?
So for the cloth ones, which are becoming very popular right now and easy to obtain, you need a few layers of the cloth, maybe 2 or 3 layers of the cloth to really get it so that it's a barrier. Because a single thin cloth, although it may look like it's a barrier, is not really effective as a barrier. So multiple, again, layers of the cloth will do it. Um, again, we're seeing more and more of individuals wearing paper masks, operating room type masks. Again, there's some reduction of transmission or, again, the risk of infection, but it's not 100%, but it's better than nothing. But again, keep in mind as you move closer to the reopening of the economy, restaurants are opening. And you could see the servers are wearing gloves and masks, but if you need to eat your meal, you're going to have to take your mask off. So at some point, again, we're going to be seeing more freedom of the mask. We're seeing that already, to the point where you're not going to be looking sideways at your neighbor in a supermarket because they're not wearing a mask and you are. It's just going to be an individual choice.
Okay, last thing. The New York Times has a piece out that they interviewed 500 epidemiologists out there who deal with fighting and studying and everything along the lines of not just this virus, but others. And there were a ton of activities that were laid out as far as when all of these doctors expected to do certain things, certain activities. And it's all from a survey. So I figured I would ask you a couple of these and kind of gauge where you think you are and maybe where we are. And I'll give you the large percentage of each answer. But in the category of activities that they said they might start doing soon, 64% said of the 511 that they would bring in mail without precautions this summer, not 3 to 12 months from now, not a year from now, where 17% said, or never again, what 3% said. So the overwhelming majority, 64% said that. See a doctor for a non-urgent appointment, 60% said this summer. Vacation overnight within driving distance, over half, 56% said this summer. And then get a haircut at a salon or barbershop, 41%, it was still the majority, 41% said this summer. Is there anything that you heard as far as any of those activities that you would wait following this summer and maybe 4 or 5 months down the line?
So, first of all, it is summer.
Well, technically, yes, it is. That's what I'm saying. So this summer could be right now that a doctor says, I no
Right.
longer have precautions when bringing in the mail.
Well, I bring in the mail, okay, and I did go to the barber, as you can see. And did I wear a mask at the barber? Yes. Do I wash my hands after getting the mail? Yes. Do I go shopping with a mask? I do. Do I wash my hands afterward? I do. I think that again, surveys are surveys. There's no it's more of a putting a temperature probe into water to see the temperature. And I think that what you're hearing is that people are optimistic that we're going to resume more of a quote unquote normal life faster than was predicted earlier this year.
Okay. I have a couple more, and this is later in the next year, to where the majority of the answers anywhere from 46 to over 50%. And you're right, a survey is a survey. At least they're all the same, right? At least they're not asking people in different fields and everything along those lines. So there is some sense of uniformity, although I understand 511 human beings are different human beings when it comes to it. 3 to 12 months down the line. Now, that's a wide range right there from 3 to 12 months, but you've explained how the virus can shift and data can dictate what could happen overnight to a week. So, I'll give you a couple. Work in a shared office, 54% said they would wait at least 3 more months for that. Send kids to school, camp, or daycare, 55 said at least 3 to 12 months from now. And eat at a dine-in, and you mentioned restaurants already doing this, eat at a dine-in restaurant, 56%, 3 to 12 months. And the last one, travel by airplane. Now, 20%, to be fair, said right now, today. 44% said at least 3 months from now. And 37% said they'd wait at least over a year to fly again.
Yeah, again, since it's a survey, I can tell you these are opinions, number one.
Sure. There's no fact or data that would support anything here.
Well, there is some issue. The issue is that if you look at it from a recipient point of view, let's take one example, which is summer camp, right? If I were sending you as my son to a summer camp this summer, I'd want to know what it is they're doing within the summer camp to make sure that your risk of contracting infection is low. So that if it's reasonable and everything is being done right, why would I wait 12 months? I would think that this is the time this summer, otherwise you'll be climbing trees. I think again that these opinions are not congruent with what we're seeing. So for example, airlines right now are not coming back to the same capacity they were in. And part of it has to do with the tickets being very expensive because they can't fly with a full aircraft and 3 people sitting in a row. There's always a seat in between for social distancing. So people are flying, and I can tell you I have. And everything in the from the minute you get onto the aircraft until you leave the aircraft, everything is done to again making sure there's not only social distancing. You're required to wear a mask, and they give you sanitizers, on and off, and as many as you want. So I think, as I said, I think on one hand, there's all these surveys. On the other hand, it doesn't really matter because the behavior of the population as a whole has changed. And it's not going to be 100% of the people who are adhering to the social distancing and the hand washing and the mask, but sufficient number of people are doing it so that we're going to see a retarded, if you will, return of the virus while we're improving our lives and the quality of life that we have.